So I recognize most of us are visual learners. And so here you see what a 24-week brain looks like versus a 40-week brain. And you can see how vastly different they are, not only in size and volume, but in sulcation pattern. If you look at it histologically, you can also see the exponential amount of synaptic connections that are occurring in the first 2 years of life. So for me as a neurologist, when I step into NICU, there are not two populations of pre, me, and term infants, but there's actually about 3, really 4 different age groups. And so insults and injuries cannot be viewed the same without the context of understanding the age of the patient, i.e. the developmental stage of the brain. Another way to look at brain injury is to think about it in a 3-dimensional way. So here's an illustration of what the ventricles look like in the first, second, and third trimester. And you can see how much the shape and morphology of the ventricles are changing in the 3 trimesters. The shape and morphology of the ventricles change depending on the varied proliferation and therefore the folding of the cerebrum as it progresses through pregnancy and gestational age. And therefore, one should think about brain injury in the newborn, not just in terms of having had injury, but when in this spectrum of time course of conception to birth and beyond, that brain injury occurred, and that depending on where in the time point of brain development, you would expect different structural or maturational changes to be affected, and that could affect brain development, brain maturation, and even brain growth. It's also a natural prejudice that we think of brain injuries as just second and third trimester events, and recognize that one can be predestined to have brain problems in terms of genetic mutations that occur and are there even before conception. But obviously, a lot of gene errors or mutations can also occur in the first trimester. And then you have to make it through second and third trimester and then go through the gauntlet of labor and delivery. And when you think about it in that fashion, it's actually surprising that more of us aren't brain injured. And philosophically, you can ask the question, are any of us actually truly born without some brain injury? When you think about common neonatal neurologic emergencies, this is like the most common top categories, and most common are the vascular events, whether hypoxic ischemic insult, intracranial hemorrhages, or cerebral vascular accidents. But whether it's something that happens to the baby or something that is inherent to the baby, a newborn is pretty limited in its phenotypic expression of having brain problems. The most common are an altered mental state or encephalopathy, seizures, and/or hypotonia. So that our job as neurologists is to elucidate what underlying etiology is causing the encephalopathy, seizures, and hypotonia.